We have heard, very commonly that artificial intelligence, but exactly what it is? It is a branch of computer science which is dedicated for the development of algorithms, computer algorithms or the software. And then what is the main purpose of artificial intelligence? Its main purpose is to work like an human intelligence, and try to learn the problem and try to solve the problem. It works like same like our human intelligence, but now computer doesn't know how to do it, right? So we have to make some algorithms, some softwares, something, so that your computer will work like a human intelligence. Intelligence was coined by John McCarthy in 1956. He defined it as the science and engineering of making intelligent machines. But nothing was much done in this respect till 21st century. Till 21st century, it was like they were using this AI only for data mining and medical diagnosis. But in dentistry, no, it was not much used. It was not actually introduced also, and still also it's not much in the clinical area, not much application. It is like people are working on it, people are doing research on it, that we will try to apply it, but not much in action right now in the clinical area. But yes, in vitro, if we see, yes, it has been used, many researches have been carried out. So it was in 2015 onwards, they started, in vitro, they started dental radiographs, they started with periapical radiographs, OPGs, and all. They try to use these new technologies for all these radiographs so that it can be used in clinical area. Now, artificial intelligence, if you see, you might have heard about machine learning, deep learning. Actually, artificial intelligence, it's a big umbrella which has got two parts. Like one is machine learning, subset of that is deep learning. Now, machine learning it's just an algorithm which helps you to learn the problem and solve it, depending upon how much data has been given to the computer. But when it comes to deep learning, it's a subset of machine learning in which you have many algorithms, and they get interconnected, they work as an artificial neural network, and they give you the exact diagnosis. If you, for example, if I, because being a doctor, I will talk about the disease, right? So if we talk about the deep learning, will give you exact the diagnosis. It will eliminate all the differential diagnosis and will give clinical diagnosis. Machine learning will let you know, yes, is it normal or abnormal, depending upon the data which has been fed to the computer. So machine learning, if we talk, it gives you knowledge about the data and the observation, whatever has been fed. Accordingly, it will give you the idea. If, for example, it gives you, for example, if the computer has been fed it up with the cases of lymph nodes in head and neck image. Okay, image, we have taken radiographs, we have given the data to the computer about the lymph nodes in head and neck region. We have given normal also and abnormal also. We have to give normal as well as the abnormal, and abnormal means many, because the computer, because every patient may have different kinds of lymph node involvement in different diseases, right? So we have to provide thousands of such images, then label it, whether the data which has been provided, it should be labeled in such a way that yes, these are all normal lymph nodes and these are the abnormal lymph node images. Okay, so once this data has been fed to the computer, then when we try to use it, okay, when we try to use it in our clinical area, when we try to use it in our research, clinical area, it will let us know that that when we are using in clinical area and we try to put image of a patient, of lymph nodes, it will tell us whether it is normal or abnormal, depending how much data has been given to the computer. I hope it's clear for you. This is how the machine learning works. It will let you know only whether it is normal or abnormal depending upon how much data has been given to the computer. Now, this computer will analyze the image, whatever you have given to the computer at the time of clinic. Deep learning is different. Deep learning will it has multi-layered algorithms are there, so they will work like our brain, they will work like our artificial neural network, because multiple algorithms are there. So it will not detect only, for example, the same case I will forward with this. Like, just now I told you that lymph node, whether it is normal or abnormal, will be detected by machine learning. It is a branch of computer artificial intelligence. But now in deep learning, which is with multi-layered algorithm, it will see the lesion ka, how is the line, edges, lymph nodes, are they mobile, not mobile, depending upon the clinical scenario, are they fixed. uh, they will try to do all kinds of, and will try to eliminate whatever is the logical elimination is required. You know how we do differential diagnosis, right? We try to eliminate the possible diagnosis, and we then finally go for the final diagnosis. It will try, because of the multiple layer of algorithms softwares, they will try to give you the most appropriate diagnosis. For that, we have artificial neural networks, this deep learning. Now, this involves a network of highly interconnected computer processes, which has the ability to analyze the data, handle the imprecise information. Because sometimes what happens, you may not have the exactly the same information which has been given to the data to the computer, the same information in your all patients. Sometimes you may not have. Okay, but now, because we have these multi-layered algorithms, it tries to handle the all the impriced information, which, and generalizing the application of model to the independent data. We have seen this artificial neural network has been used for interpreting, plain radiographs, ultrasounds, CT scans, MRIs, radioisotopes scans. Now, recently, convolutional neural network is developed using self-learning backpropagation algorithms to learn directly from the data via end-to-end process to make predictions. This is again, it's an algorithm. Definitely, it's an algorithm, but it is, it has the capacity to learn from the self-learning back propagation, whatever data has been given to the computer before and after. So we'll talk about the application of artificial intelligence. Uh, First, we'll talk about the triage scenario. Now, when it is triage, it is usually the screening. Yes, AI can help us to screen the examinations, and based on the probability of disease, which may show you whether it is positive or negative according to the AI. For example, it helps you to detect. It helps in detection. For example, there is a nodule. It helps you to detect, yes, there is a nodule. But what type of nodule? Yes, we'll go for deep learning. Deep learning will give us whether it is normal or abnormal. Replacement scenario. AI can detect minor changes in image, saving the observer's time, and also it can help by retrieving the previous data of the patient, or finding similar findings in other images which has been provided a list of possibilities. So it can, because this is a replacement scenario, that means it is replacing the radiologist. So to some extent, yes, it cannot replace the radiologist completely, definitely not. But AI is not meant to replace the human completely, but yes, it can detect, to some extent it can help radiologist if he's not there also. Still, yes, depending upon the patient findings, it will give you the list of possibilities of the disease what the patient could have. AI, they're consistently more accurate if they are more rapid, reproducible, and easier to obtain. Segmentation, it can do to isolate a structure from the other studies. For example, it can detect as the boundary of an organ, lesion, size, texture. Add-on scenario where you are using AI, okay, but you are dependent on the radiologist interpretation also. You take one more on opinion from radiologist also. Because a radiologist will tell you the provide the more confident diagnosis, and also the classification, the structure for reporting in patient imaging. Now, this was in general application. Now, because our topic is mainly of application of AI in oral and maxillofacial radiology. Okay, let's discuss about the application in oral radiology. Now, this is the first thing. It's used in almost all the 9 branches of dentistry. We can use it, whether it is orthodontics or restorative or endodontics or oral medicine, radiology. For everything we can use it, even in when you are planning, if you are planning to do any kind of research for the survey or any community screening, anything, yes, you can use it. Now we'll first discuss about perio for the bone loss. Everything you have its application in each and every field. So first thing, let's discuss about the orthodontics. You know that the orthodontics, they take lateral ceph and then they try to do the analysis. So usually we do with the uh, digital lateral ceph, and then the analysis is done by digitally. Okay, but now these networks, these artificial neural network, it can locate the problem in the digital radiographs are that if there are any landmarks which may be partially hidden, or if the image has low contrast, or if there is any kind of overlapping that are not visible, that doesn't make the visibility of the some of the landmarks with our naked human eye, it becomes difficult. So that time our artificial neural network is going to help us out. Okay, so we it will help us to, because how it will help us is because it is this convolutional neural network has the ability to pixel by pixel elaboration of the image, and knowledge based algorithms help you to locate even the new anatomical landmarks in a more robust and precise way. That means that even if you have any kind of new anatomic landmark, or any landmark which is hidden partially, or which you are not able to see, any issue like that will be sorted out with this, because data about the anatomical landmarks, they are given to the computer. These multi-layered algorithm are going to detect all kinds of anatomical landmarks and help you for the cephalometric analysis, for planning of any kind of orthodontic or orthognathic surgeries. So this is the you know um very nice help for the orthodontist, so that their planning of treatment and prediction of how the treatment is progressing and post treatment, everything will be clearly seen for the patient. It will also help, because everything will be clearly, it will give us clear information. So it will help orthodontist in determining whether you need to do any kind of tooth extraction, or you want to monitor the tooth movements or tooth development, the staging of tooth development, landmark markings, so in a more accurate and definitely time saving, and eliminating any kind of laboratory procedures. When we used to do model analysis, we definitely before used to take casts, and then again we have to send to the lab for making the cast and all. Now we can do is we can make the digital impressions, and then immediately we can use the artificial intelligence, and within no time you will get all the analysis done. So that is the benefit of using artificial intelligence, and that can be done even if you are not there. For example, you are working in a city, and in remote area any other dentist, he wants to go for the orthodontic treatment, for example. He is planning to do orthodontic treatment for the patient, fine, he can send you, and this artificial neural network can help him doing the tracing, doing the model analysis, and within no time he will get the results, and he can go forward with his treatment. Evaluation of periodontal diseases and bone density, you know checking the early detection of alveolar bone loss, change in the bone density, early area of furcation involvement, early risk of osteoporosis. It's very difficult to detect everywhere. You don't have densitometers to check the bone densities and all. So Krauss et al. Found that CNN showed higher diagnostic performance with an accuracy of 81% than the individual examiners, who showed an accuracy of 76% in the radiographic detection of periodontal bone loss. So we could see that once our data of periodontal disease has been given to the computer, it can help us to detect, even if it is very early bone loss, early changes in the bone density, early furcation involvement, or early risk of osteoporosis. You can see in this image that these early detection, it can be clearly visualized. It will highlight that area of early bone loss. You have the conventional and you have the digital, both pictures can be clearly visualized, and you can see that even, sometimes you may see the radiograph and these things may get unnoticed, especially the early one. It may get unnoticed by any one of us. So ANN can help us to detect even the early changes, whatever is there, we can detect clearly. It can give us information, and then we can do our treatment planning accordingly. Okay. Now comes your periapical pathologies. Periapical lesions such as abscesses, granulomas, and cysts, they are apparent on radiograph, definitely. But some may go unseen as the image may have low contrast. The same problem is with the bone loss also, because you may not see the early, and the contrast of the image, it depends. So if you have these abscesses, cysts, granulomas, they may, you, because of low contrast of your image, sorry, because of low contrast in an image, it may go unnoticed. But once you have these AIs, you have these multi-layered algorithms, it will help you to detect, to define the boundaries of the lesion in a more precise way, enable their differentiation, and give you clear knowledge about periapical pathology. It can accurately locate the tooth areas which are prone to caries and complex periapical pathologies. You can see this image. If you see the upper one, these are with the normal, radiographs. Here you can see the radiograph where you can see there is a lesion. If you see this radiograph right side, you have a lesion in the left right angle of the mandible. You can see here, right angle of the mandible, you can see there is it's a multilocular radiolucency. And in AI they have clearly marked it, highlighted it. So without seeing the boundaries of the lesion, without describing, what we do, we see the location, periphery and shape, then internal structure, effect on surrounding structures. you know we this is how we definitely interpret your radiograph. Now here it is highlighting. So even if it's if you see this, this one gives you more clear vision about the boundaries, about the effect on the effect on the surrounding structures. Is it multilocular, unilocular? It can give you a clear information. And if it is at multiple places, if it is a multifocal lesion, it will give us knowledge about it. Then you can see this another radiograph where you have the patient with a unilocular radiolucency at the left angle of the mandible, and here see it has clearly highlighted that area. Then comes your maxillary sinus pathologies. Pathologies, they are, you know uh, we do take Waters view of, or we can take the coronal section of the CT scan for detecting the maxillary sinus. But the problem with Waters view is, most of the time, because of overlapping of petrous part of temporal bone over the maxillary sinus, your you may get false negative results. Because of, because sphenoid sinus, it's very, it's not that much clear in Waters view. You need to be perfect. Really, you need to be clearly perfect in taking the radiograph so that you can see the sphenoid sinus, because it's too interior. And then, yes, I know that you will, the Waters view, you need to uh, ask the patient to open the mouth, then 37-degree head tilted upward, all that we do it. But most of the time we may miss the sinus because it is more technique sensitive. So diseases, if they are with the paranasal sinuses and all, for that we have this AI, and that is really going to be, you know helpful for the physician to diagnose the disease. If I take the simple example of sinusitis, you know that if the mucosal thickening of maxillary sinus, it's more than 4 mm, we have to check it out for sinusitis. And more common, we cannot see it in much clearly. Usually we go for verification, we go for CT scans, and to check the air fluid level, or sinus opacifications, uh, we go for CT scan and all. But sometimes due to overlapping of the structures and by facial bony structures, it is gives us false negative results. So deep learning programs, it increases the diagnostic ability of conventional radiograph views, thereby trying to avoid any kind of unnecessary referrals of patient for CT examination which have high radiation dose. Because I told you before also that when we go for Waters view, it is more technique sensitive. We may miss the lesions which are the mucosal thickening air, for example, the mucosal thickening, air fluid, or these air fluid levels, or anything opacification in the maxillary sinus. We may miss the sphenoid sinus. So uh, we go for CT scan. We definitely ask the patient, okay, we cannot see here, okay, go for CT scan, then we will see the coronal section, right? But CT scan again have a very high radiation dose to the patient. You agree with me? So to avoid that high radiation dose to the patient, and CT examination is definitely expensive for the patient. All the patients cannot afford CT examination for sinusitis. It's a simple disease. Patient may say, oh, for sinusitis, you are telling me to do CT scan. No. right? So to avoid that kind of CT examinations and giving unnecessary radiation dose to the patient, we use deep learning programs over the digital radiograph, and that will help you to detect any kind of abnormality which is seen in the maxillary sinus, or let it be any paranasal sinuses, we should say. Any problem with the paranasal sinuses, it helps you. Even if you have, rhinolith, antrolith, small antrolith, small rhinolith, if there are osteomas in your frontal sinus, this definitely is going to help you. Because if the size of the lith is very small, maybe, or some, some kind of radiolucent liths are also there, which may get unnoticed, uh, if we take simple digital radiograph. But yes, if you have ANN, CNN, you have these deep learning programs, they will help you to detect all these kinds of liths also. Then next comes your caries detection. uh, it mainly, we have the Logicon caries detector. It is a program which helps you to detect the uh, can detect and characterize the proximal caries. DeVito et al. Found deep learning system improved diagnosis of proximal caries by 39.4% in comparison to the bite wings. And it also helps you to detect the working length determination, your apical foramen location, detect the vertical root fracture. Again, if I will tell you, these are all, in vitro programs which has been researches have been carried out. Still, we need to do more research based on these applications. We have to do more research so that we can use it in clinical arena. You can see in this image that how these deep learning systems help us to detect the caries in the proximal areas. You can detect the, as compared to the deep bite wings and radiographs they have shown us over here, they can easily help you to detect where is the enamel, where is the dentine enamel junction, where is the pulp, where is the caries, how the caries progression is occurring, how the involvement has it has it crossed the dentine enamel junction, not crossed, is it involving the pulp, not involving, where is the exactly the apical foramen, where is the working length determination if you're doing any kind of endodontic treatment, or any vertical root fracture. These all can help you to detect. And next comes your oncology, of course. It helps you to detect any early detection of head and neck cancers and cervical lymph node metastasis, which definitely is going to help you in the treatment choice and prognosis. Because of head and neck cancer patients, we have stage 1, stage 2, stage 3, stage 4, depending upon the involvement of lymph nodes, how many lymph nodes are involved, is it unilateral lymph node involvement, bilateral lymph node involvement, how is. So we usually go for CT MRI to identify cervical lymph nodes and sentinel lymph nodes. That is the first lymph node which has got involved. These are very important to detect. Recently, Arigi et al. Found that CNN enhanced CT based diagnosis of lymph node metastasis. The performance of CNN classification resulted in accuracy of 78.2%, a sensitivity of 75.4%, and specificity of 81% as compared to experienced radiologists. These systems can help you to classify whether the lesion is benign, potentially malignant, or malignant for early treatment interventions. If you see like this, we can help, it can, ANN deep learning can help us to detect the lesions, even if it is in the sentinel lymph node, if it is in the early stage, if it can help us to classify benign, malignant, potentially malignant. anything, whatever it is, and you can do planning for your treatment, you know your prognosis of the disease. It can give a magical treatment for the patient. It can help you.
என்னென்ன கேஷ் வேணுங்க? என்ன கேஷ் வேணும்? டீக்கு வேற, இது பாலுக்கு வேற.
Then comes your TMJ osteoarthritis.
பால்
I'll just tell you one more thing. This here, lot of um research is going on for the head and neck cancers, because you can visualize the lesion, because sometimes, if it is in the areas where your eyes or where your radiographs will not give you, conventional digital radiographs cannot give you much information about the involvement, how much deep the lesion is, the involvement of the surrounding structures. This AI can give you in no time, it can give you all the information. Then comes your TMJ osteoarthritis. Osteoarthritis is the most common degenerative disease affecting TMJ, and it is characterized by the destruction of
எமர்ஜென்சி என்ன?
articular cartilage and subcondylar bone resorption. You know that TMJ, when there is a degenerative disease, it is, if you take panorama radiograph, for example, you can, this is how the AI works. It will first show you, it will detect the condyle, then it will determine whether this condyle is normally taken or abnormally taken, because it has to detect whether the technique which was performed, was it normal or abnormal, was the technique properly done for taking the radiograph or not. After it says yes, your it is normally taken, it is not, the technique was perfect, then it will let you to know, uh, was there any abnormal lesion, any degenerative changes has been seen in while taking the condyle or not. So it will detect abnormal and normal, then it will give you classification which type of degenerative disease the patient is having. And same way, it will, this AI works for all the diseases. The first thing it will try to show you, first it will detect whether whether the radiograph has been taken perfectly as it is supposed to be taken, because sometimes, technician can also do, he's a human being, he can also do some mistake, right? We can also do some mistakes. So while taking the radiograph, we have to see whether the radiograph was taken perfect way, in a technique was right or wrong, right or wrong. So it will help you to first detect that. Okay, but now once the computer said yes, it is perfectly taken, it is the exact radiograph which we need to be. It is then it will detect the lesion. Where is the lesion? Okay, after this is lesion, then it will detect it's this is not normal, this is abnormal, then it will detect the classification, it will help you to classify it, which type of disease the patient is having, under which classification it comes. So for TMJ osteoarthritis, Dumas et al. Described neural network which helps you to classify these morphological variation of the condyle into 7 categories. G1 is normal, G2 is close to normal, and G3 to 6, depending upon the different stages of the degeneration, it has been classified. A rainbow color coded map on 3D models define the exact location of the morphological changes of the condylar surface. Sjogren syndrome. Sjogren syndrome, we all know it is an autoimmune disease, right? Now, there are softwares. These have emerged. It's not been done yet, and we cannot use it for all in autoimmune diseases right now. But the research is going on. They have shown that this deep learning system has a promising approach for the analysis of the effect of systemic autoimmune diseases on the oral cavity based on the data sets which has been obtained from large group of patients which were affected by systemic autoimmune disease. Kiss et al. Assessed the cases of Sjogren syndrome on CT with deep learning system and observed that there is an accuracy of 96% sensitivity and 100% and specificity of 92%. They suggested that deep learning system may be used as a diagnostic support for the interpretation of CT images Sjogren syndrome patients. It has been just suggested, but we need to do a lot of research. It has to be carried out on a large number of the patients, and we need a good sample of patients with autoimmune diseases and their effect on the oral cavity, and then it can give us the promising approach for the future. Then comes your headache. We have primary headaches and we have secondary headaches, and we know that headache is definitely, whether it is migraine or a tension headache, they have a significant impact on the quality of life of an individual, right? So these primary headaches, when we say primary headaches, sorry, primary headaches have no associated underlying organic cause. Okay, then it's okay, there is no organic cause. But yes, when we talk about the secondary, it is, there is an underlying disease process. Because of that, the patients may have the headache. Physicians usually, till now, till date, physicians diagnose the patients with chronic headache symptoms based on the clinical examination and imaging modalities such as MRI, and usually they prefer the medical management for the treatment. Kraswickel et al. Developed an automated three-component system for classifying headaches disorder by a dysentery algorithm, and they found that automated techniques were highly accurate and reduced the classification errors, because there are chances of errors in classifying the type of headache the patient is having. They could be, because we have different types of headaches, and it's only just based on the patient, what he says about his symptoms, and all, we classify it, right? So, but when these we use this dysentery algorithm, it helped us in a better way in reducing the classification errors. Then comes our forensic, yeah, forensic dental imaging. That helps you, till now, till that we can classify whether, no, you want to classify based on the genders, based on the age estimation methods, right? And these AI has shown that promising approach in diagnosis of the gender classification, because now Bevis et al. Found that neural network showed 95% of accuracy in distinguishing the sex of anthropological skulls reconstructed from CT scans. What they did is that they reconstructed the skulls, whatever they have got from CT scans, and then they used these neural networks to classify whether it is male or the female skull, and they have found that 95% of accuracy. Intelligent system could also improve the accuracy of age estimation, although very limited studies have yet investigated the application of neural network for age determination. Then comes your oral and maxillofacial surgery. I'm talking about the most common application of AI. When we usually do, what we do is, if we have oral surgery, oral surgeons, they will agree with me, the surgical removal of lower third molar is challenging due to the close proximity of the mandibular third molar and inferior alveolar nerve. These procedures can result in damage to inferior alveolar nerve, and which causes the neurosensory impairment in the chin and the lower lip. Now, this intelligent system, they have revolutionized the field of oral maxillofacial surgery by introduction of image guided surgery. So that will help them to perform the surgery in a more precise way. So image guided surgeries, or even if you want to put any kind of implant, these image guided will help us. Now, because of this, Vinayalingam et al. Performed automated segmentation on panoramic radiograph. In simple panoramic radiograph, what we do, detect the proximity of M3, that's a molar, in relation to inferior alveolar nerve before the surgical removal of third molar, and suggested that it was an encouraging approach to the segmentation of anatomical structures. Usually when we are doing it on a panoramic radiograph, we take definitely panoramic radiograph before doing any kind of third molar extraction. But if we have any doubt, whether we go for CT to see the differentiation, we go for CBCT to see the distance from inferior alveolar canal and the third molar, we do it, right? But if we have ANN, we have these neural networks with us, with this intelligent system, without going for extra radiation exposure to the patient. On the panorama itself, it can help us to do the segmentation of the anatomical structures and tell you the exact distance or the proximity of mandibular third molar to the inferior alveolar nerve. You can see in this image, this is how the classification of third molar with the inferior alveolar nerve. If you see the first figure, we can see that the third molar and inferior alveolar nerve seem to be superimposed. Huh? But when we used our intelligent system, we can see here the intimate but non-contact positioning between the third molar and inferior alveolar canal. True contact positioning. You can
Ms.
see
Radhalakshmi?
here true contact positioning between third molar and inferior alveolar nerve. Inferior alveolar nerve buckled to the third molar. So all these CBCT computerized tomography is taken for the same detection. Again, there is a radiation exposure. We are doing it, but you are giving unnecessary exposure to the patient, right? So this, with this conventional only, we can detect by using our deep learning system. So these were all the applications of uh, intelligent system in the oral radiology. Now, what are the advantages of using? We discussed so many advantages till now. Now, in nutshell, how it reduces the burden on radiologist workload. Definitely, it provides information based on functional performance of tissue and organ and disease, and reduce the human error. Accurately tracks the growth of the lesion, tumors over the time. More quantitative, more objective diagnosis, escalates the priority cases within the radiologist reading queue, because radiologists may have long queue of readings
அந்த
interpretation.
26th
So if
webinar
this is
எடுத்தாச்சுல்லம்மா?
done by AI,
ஓகே, ஓகே.
and if the
இந்த 28th
add-on
எடுத்த webinar
scenario, you
எடுத்துருக்கீங்க.
remember I told you before, we have
28th
add-on
28th
scenario.
வரைக்கும்
If we
போகணும்.
want to have an add-on
கரெக்ட் தானே?
opinion by the radiologist,
28th
priority
ஃபுல்லாக
based,
இருப்போம்
he
நம்ம.
can do it.
தேவைப்படாது, ஏன்னா 29th காலையில் 10 மணிக்கு.
Automatically read incidental findings,
அதுக்கு அடுத்து அது
extract
அது
relevant
அடுத்தது வந்து வேறு ஏதாவது அந்த
information,
பப்ளிகேஷன்
schedule the
ஆப்ரேஷன்ஸ்
follow
இருக்கு,
up,
அதை
and
ஆட் பண்ணி
prompt
வச்சுருக்கோம்
referring to the
ரிமைனிங்.
physicians.
எப்பவுமே நான் ஒரு டேட், இப்போ வெபினார் ஒரு டேட்
But yes,
கொடுக்குறோம்ல,
definitely,
டேட் வந்து
we are
டேட் ஒரு
still
நாள்
in
முன்னாடியோட
an
அந்த ஆடை போஸ்ட் பண்ணிடலாம்.
budding stage
அது
of
அந்த ஆட்
using
என்னன்னா நம்ம
these
10 மணி
artificial
வரைக்கும் 10
intelligence.
மணி வரைக்கும் கூட ரன்
It
பண்ணலாம்.
requires a very
11
huge
மணிக்கு லைவ்
and
போயிடும்.
sound
லைவ்
data
போனதுக்கப்புறம் அவங்க
base
ரெஜிஸ்டர்
of
பண்ணால் நம்மளால் ஒன்றும்
knowledge.
பண்ண முடியாது.
If
ஸோ
not, it
அதனால்
may result
மேக்ஸிமம்
in
உங்களுக்கு
an
காலை 8 மணி
inappropriate
ஸ்லாட் இருக்குல்ல, 8
answer.
9
That is the
10 மணி
problem
வரைக்குமே
with
ஆட் போனால்
this
பிரச்சனை இல்லை. அதுக்கப்புறம் அப்புறம் நீங்கள் ரிவ்யூ
AI.
பண்ணிக்கணும்.
We
இனிமேல்
need to
ஓகேவா?
have
சரி,
a
என்ன
good
டேட்டோ அதோட 10 மணியோட முடிச்சிடணும்.
amount of data which needs to be given to the computer when presented with images outside of the knowledge set. For example, when image technique is not appropriate, or if there are any artifacts we in the radiograph, it may result in faulty interpretation. It may result in false positive or negative interpretation if images are outside the trained data sets. Radiologists should have adequate knowledge and trained regarding the computational algorithm, data science, for better implementation of this technology. because radiologists usually don't have much knowledge about the data science, about these algorithms. They should be trained so that there is no false positive or negative interpretation of your images. Use I would like to recommend that use of intelligent system in dentomaxillofacial radiologist. It's only in vitro studies, studies on skull, studies on radiographs. No study have been performed in real clinical situation to verify the true applicability of these systems. In the near future, more clinical trials pertaining to intelligence system should be funded by the government to facilitate the testing and implementation of this technology in clinical practice. Because this AI, it cannot be done without any government funded system, because we need to have funds to use these systems, to do more research on this, to get more data, to use it so that it will be helpful for the patient as well as for us. So I would like to conclude my
இது ரீசார்ஜ்னா
discussion on dentomaxillofacial radiology that intelligent system
என்னைக்கு
plays an
முடிஞ்சிருச்சா வேலைக்கு
important role in making
ஓடிபி
diagnostic
வரலையா
recommendation to get a quick diagnosis,
இல்லையே வருமே அது
treatment
ஓடிபி
plan
இப்படி
for especially for the
ஒன்ஸ் அந்த
complex
இன்கமிங்கும்
problems.
வரானா வர
These
கொஞ்ச
systems
நேரத்தில்
have definitely reduced
அது வராது
radiologist workload. Will
அந்த நம்பர் ஓடிபி
not
வரும்
now,
அந்த
but yes, it will definitely reduce
இது
the
ரெண்டு ஓடிபி
workload
வருமே அதுக்கு
and allow
அதில்
radiologists
ரீசார்ஜ்
to
பண்ணோம்னா அது நம்ம
improve their
போனதுலேருந்து 3
relevance
மந்த்ஸ் கழிச்சு
and
ஓடிபி வரும்
value. Therefore, radiologists should
அந்த முதல் ரெண்டு
educate
நம்பருக்கு
themselves
நீங்கள் நாட் இன் யூஸ்னு
about
வந்துச்சுன்னு
these
சொன்னீங்க இல்லையா
softwares,
அதுக்கு மேபி
computational
ஓடிபி வராது
softwares, in
அதனால
order
செக் பண்ண
to
சொல்லுங்கள்
implement
ஸ்டேட்டஸை
these new
ஷேர் பண்ணிக்கோங்க
developments in a safe and appropriate way.
மற்ற
These
ரெண்டு நம்பர் ஓடிபி
systems
போட்டால்
have a
வந்துடும்
promising and bright future both in general dentistry and maxillofacial radiology. These are my references. Thank you. Thank you so much.
இந்த வரேன் ஒரு நிமிஷம் ma'am, thanks for your time. So hope the session was very informative for all of you. If anyone want to share any of your feedbacks, or if you want to have any queries or clarification, you can just drop your questions here, so that Dr. Sheetal Mujoo will be able to just give you a clarity on the same. I hope everyone is clear with those things. I'm really happy that you all been cooperating all this time. So, ma'am, once again, thanks for your precious time and just giving you the entire outcome of your the AI and oral radiology application innovations.
Thank you so much, sir. Thank you so much for giving me this opportunity to discuss about the AI in oral radiology. Thank you so much, sir.
Okay, ma'am, Ms. Ravina Kumari has just has a doubt. She has raised on it.
Okay. Yes.
Ms. Ravina Kumari, please. I request you to just unmute yourself and just talk. Ms. Ravina Kumari, I request you just unmute yourself and talk. Fine, hope she is not able to do that. So anyway, request, we have all shared you a feedback link to this same chat itself. I request you all to take a note of that link and just fill the feedback form to get your participation certificate with the next 48 hours of time. And once again, thanks for all for your patience and time there. And once again, thank you, ma'am. Have a great day.
Thank you so much, sir. Thank you. Thank you. Have a good day, sir.
Thank you.